Today we are going to be doing the manual muscle test for the posterior tibialis for foot inversion. The posterior tibialis originates on the interosseous membrane in the adjacent tibia and fibula and inserts on the navicular and most tarsals and metatarsals. This muscle is innervated by the tibial nerve. For this test, we are going to have the patient in a short sitting position. The therapist is going to have one hand stabilizing at the ankle just above the medial malleoli. The resistance hand is placed over the dorsum and medial side of the foot at the level of the metatarsals heads. Resistance is going to be directed towards eversion and slight dorsiflexion. For a grade 3, the therapist is going to instruct the patient to invert their foot or turn your foot down and in and hold it.
Turn your foot down and in. Hold it and relax.
For grades 4 and 5, the patient is going to again invert their foot, and the therapist is going to place their hands above the ankle at the malleoli and on the dorsum side of the foot on the medial malleoli, and apply resistance in the direction of eversion and slight dorsiflexion.
Turn your foot down and in. Hold it there, don't let me pull you up. Hold it. And relax.
For a grade 2, the patient will just complete a partial range of motion in this same position. For a grade 1, the patient will be in the same position, and this test can also be done in supine as well. The patient is going to try and turn their foot down and in, and the therapist will be palpating the tendon of the posterior tibialis, which is between the medial malleolus and the navicular bone.
Try to move your foot down and in. And relax.
If a contraction is felt, this will be a grade 1. If there is no contractile activity, this will result in a grade 0. And this concludes the test for posterior tibialis for foot inversion.